effort to help increase survival rate and decrease cancer mortality in Nigeria, Mecure Healthcare Limited has put in place oncology facility services for cancer diagnostics, radiotherapy, and chemotherapy. On this week's episode of the Sarah God Show, I'll be having a conversation with the management staff on what the center is all about. Stay tuned. Hello and welcome to this episode of the Sarah God Show. Joining me now is the Chief Medical Director of Mecure Cancer Center, Dr. Adeoluwa Adeniji. Good to have you on the show.
Yeah, thank you very much, Sarah.
You're welcome. All right, so tell us about Mecure Cancer Center. Why was it established?
Okay, thanks for that question. Mecure Cancer Center is the oncology arm of Mecure Healthcare Limited, and the purpose of establishing it is to be able to, number one, take care of the screening that people do so that we can detect cancer early, and number two, to make the best diagnosis for people in terms of cancer with the best of the precision, accuracy as much as possible. And of course, to give the best treatment that can be found anywhere in the world. And that is the purpose. And one of the things we have also incorporated into what we do here is affordability. We do know that cancer care has this financial problem. People are not able to afford the best because they don't have money. But we have a program called 2080, which focuses on affordability, and it makes people to be able to access the best of the healthcare here at Mecure Cancer Center without breaking the bank as much as possible. Thank you.
All right, thank you very much for that, Dr. Adeoluwa. Okay, recently the center had a Cancer Day walk to fight and also to create awareness for cancer in Lagos State. What inspired that?
Okay, great. Basically, 4th of February, every year is the World Cancer Day. And the truth of the matter is, there are people there who don't know much about cancer. So one of the things we do is to take advantage of the World Cancer Day to create massive awareness. We don't want to just be whispering what cancer is, the best information about it. We want it to be very loud. And that's why we had this Beat Cancer Walk on Saturday as much as possible that involved, almost hundreds of people. And we went into the communities and we were able to give them the awareness, tell them what is good about cancer that they need to know, and they want the information they also need to discuss, because a lot of things flying all over the internet, and some of them are not correct at all. So awareness program, we have them to know what is it. And the most important part of the awareness program is for them to be able to come for screening. And I am so excited to let you know that we are actually screening at least 1,000 people for free. People are going to come in for breast cancer screening, cervical cancer screening, and also prostate cancer screening for free. They don't have to pay. And that's what we are doing now. And that's what we are in. Thank you.
All right, thank you very much. So let's look at the theme for this year's World Cancer Day, which is focused or centered around close the care gap. How can we get this done? How can this be achieved?
Okay, thank you very much for that. So the theme actually is close the care gap, and what that means is that as much as possible, everyone should be able to have access to cancer care, irrespective of their location, irrespective of their financial status, as much as possible. It's just common that people that have money can have access to the best of the care, or people that live in certain countries can have access to the best of the care, while others don't have at all. So we're trying to close the gap as much as possible. And the gap is usually caused by, number one, knowledge. So awareness will take care of that. Number two, availability of infrastructures and medical devices, availability of professionals, which we have to close also by training people, collaborating with sponsors to ensure infrastructures, machines and drugs are available. And of course, the financial implication. So we need to ensure that people can afford, healthcare, oncology care as much as possible, irrespective of their location, irrespective of their financial status. And at Mecure, we have 2080 program that also addresses that. Thank you.
Wow, great. Thank you very much. All right, we know that the world is evolving with digital tools and technology. I would like to know, are there tech-based treatment of cancer?
Yes, thank you very much. The world is going digital now, and the world has become a global community because of the internet, online activities, as much as possible, especially on the social media platforms and also other digital platforms. So we are there, and anyone that is not moving digitally in this generation, in this time, obviously will be left behind. So we can't afford not to be able to help people, because we have millions of people on the online platform, and that's what we stand for. For a number of years now, Mecure generally has been able to bring in, mobile apps, being the first even in the country. Wow. There is the Hello Doctor app, then there's the one for the patient. So in such a way that you can consult a patient even without being physical with them. Teleconsultation is there, and also the individuals can come in for their test as much as possible and then get their results on the mobile app and look at the images. So they don't need to even come for the physical films. Wow. Or physical report. The report will be there, the images will be there, and their doctors can have access to these to treat them, to save time, to ensure that they have the best of the care. So the world is going digital, and we are also there. There are a lot of innovations going on in the diagnosis. For example, we are talking about next gene sequencing, liquid biopsy. We are talking about PET CT scan, which we have at Mecure. And Mecure is the only one in the entire West Africa with PET CT scan. I always like to let people know that PET CT scan, for the first time, was approved 20 years ago in the US. And the purpose was for clinical research. Then, after some years, it was approved for clinical clinical activities or clinical, care, as it were. But I want to say this, that for the first time in the history of West Africa, we are having PET CT scan just about a year ago. So we got it in when we started using it, and this is the only place people travel all over Nigeria to have access to this, tool, modern tool with the best accuracy, the best precision when it comes to diagnosis. And also people travel from outside Nigeria, from West Africa, even from the Europe. We have a number of people that have come because it is more affordable, in this part of the world. So we have a lot of technology going on. And I would like to say this. We have more coming up, which we will announce in due time. So Mecure stands for digital. With digital platform, you can reach more people. You can even consult where they don't have oncologists. Like in Liberia, I've consulted, one of their top officials, government officials. Yes. They don't have any single oncologist, but I was able to, give them, my recommendation for the team and things like that. And it's changing the whole world now. So we are there.
All right, thank you very much. Before we go, what's your advice to people out there on how they can prevent cancer?
So my advice for people there is to ensure that they go for annual screening as much as possible. And also try as much as possible to get the right and the best information about cancer prevention. For example, concerning cervical cancer, which is known today to be a preventable cancer, the role of vaccine, the Gardasil vaccine, as much as possible, which will prevent, the activities of HPV, human papilloma virus, and eventually there will not be any development of cervical cancer. Such vaccines are usually given to the boys and to the girls from the age of 8 years and above. So as much as possible, this information is right there. You need to know, and also you need to go for it so that cervical cancer can be prevented. The same thing applies to breast cancer. There are risk factors associated with breast cancer. You need to know them.
Thank you very much. Thank you very much for joining me.
You're welcome. Thank you.
Cancer can be defined as an uncontrolled growth of cells. Uncontrolled growth. Normally we have normal cells, but in cancer, their rate of growth is not controlled. The cells grow without control, and then they will now enter into the tissue. That's what we call tissue invasion, and then metastasis. Cells supposed to have a patterned growth, but in case of cancer, they don't have that control. They just grow on their own. In fact, to a layman, I would say they are mad cells. There are three major things I would say are the main causes of cancer. We itemize it in environmental conditions, viral conditions, and chemicals. So it's one of it. Our lifestyle, we are no more as active as we are. And then there is many cases of obesity. And obesity is a culprit in many diseases, not only in cancer. In diabetes, obesity is there. In hypertension, obesity is there. So in cancer is a major risk factor. Because when there is obesity, it disposes one to a lot of diseases. Maybe the use of drug, like in women, most of them now, because of the issue of family planning, they go on to use all these different family planning, especially this contraceptive, oral contraceptive, which is more made up of more of estrogen. And estrogen is a culprit in breast cancer. When there is high estrogen, there is high risk of getting breast cancer. So it's also part of it. Then when it comes to chemical, talk of the environment, like benzene, some of these things that they use in zinc, it is not good. Maybe when rain fall, like some areas that lack water, they will fetch water from there, which is not good for the body. Also is diet, the type of diet we eat. Like some people like eating fatty food that are more in high cholesterol. Like men, they like eating red meat, and they will even support it with alcohol. And it's a very bad combination, and it predisposes them to prostate cancer and also colon cancer. So high fatty food predisposes is also a risk factor. Then when we come to the viral, I said environmental, viral, and chemical. Then in the viral, we have some viruses that can cause cancer. We have like human papilloma virus, which is a culprit in cervical cancer. Is the main cause of cervical cancer. Then we also have hepatitis B virus, which is also a cause of liver cancers. We also have HIV, which is also a cause of one type of cancer that they call Kaposi sarcoma. Kaposi cancer is a type of cancer from HIV virus. Then we also have SMB virus that causes Burkitt's lymphoma. It's also a type of cancer, but we call that type of cancer a liquid cancer. Cancer, we have solid cancer and we have liquid cancer. Those that are lymphoma and blood cancers, we call them liquid cancer. But the other one that affect the tissues, we call them solid cancers. Prevention, they say, is better than treatment. In prevention of cancer, there are lots. It's for us to change our lifestyle. Like I've mentioned, all those things, the way we are doing, we should be very active life. We should not be sedentary. Even if you are working at sometimes we need to walk around so that we will not be static for the whole day. Then that will help us to avoid obesity. We should watch our weight. Watch our weight. When you check your weight and you see that it's growing, you are gaining, we do something to curtail it. Then you mind what you eat. Instead of going to all this eatery, if you look at it now, everywhere is a lot of eateries are coming up. And people are patronizing them, thinking that they have the money and they can afford it. And that is what is causing more problem, because you can just walk in there and buy anything. I know a family that in the morning they will just drive their kids to that place to buy something in the morning. In the afternoon, when they are coming back, they will lunch there. That's a bad life, and those children will grow like that. And when they grow up, they will think, this was the way our parents were doing. They will just go because they feel they have the money and they are predisposing themselves. You should see now all those children, all those rich children. You see how they are. Childhood obesity. They have started being obese from childhood. Do you understand? So by the time they will get to adulthood, when they cannot utilize, they don't have time to waste the energy as much as when they are in a child, it will become a problem. Do you understand? So we should be active, we should avoid obesity, we should mind what we eat. We encourage people to stop smoking and excessive alcohol. Then in cervical cancer, we do vaccination. and not only vaccination, it's able for us to be maintain fidelity in marriage. Or if you are not in marriage, you have a particular sexual partner, because that's a problem in cervical cancer. When you move from one man to the other to the other, okay, the HPV is carried by men, and when the man is the type that flex around, he will if he has it, he will now spread it among all the women, and another man that will have a sexual affair with those women will also carry it. Do you understand? To another side, and that is how it spreads. And then it is the woman that will now start manifesting it. So if you have one particular sexual partner, I don't think it will help to reduce the spread of it. So as it, and then we also encourage them, like in cervical cancer, to use condom. Like in advice, some people still are not aware of cancer, or some are aware but they don't believe. Over my dead body, it's not my portion. In fact, when they get the information, they will just, instead of going to the right place, they will go to the church, go and meet their pastor, see what I am hearing, that will pray for me. You understand? That is what is causing the problem. If you look now in Nigeria, many cases of cancer are there, but they don't come to hospital on time. They would have gone round and round and round before they will come to the hospital. It will be at the death stage, and later they will now say cancer is a death sentence.
Good afternoon. Can we meet you, please?
Good afternoon. Nice to meet you. Myself, Farhad Hussain. I'm the PET City and Cyclotron Manager, Mecure Cancer Center. And this is actually the PET City machine, which is very advanced technology for the cancer detections and as well as for the detection of neurological disorder as well. So here we are the first PET City scan service provider in whole Nigeria. Not only whole Nigeria, even in whole West Africa, we are the first. Okay, so this one actually we can tell this PET City machine is a third eye of the doctor. You can ask me why it is third eye of the doctors. Okay, is very important for, because when you do regular CT scan and other diagnoses, you might, that diagnosis will not give you the complete information about the cancer and it is spread. Okay, whole over the body. But this PET CT scan, it is whole body PET CT scan, and it will give you very nice superficial image, which can ensure you that wherever in the whole body you have cancer. Like suppose you have breast cancer, but you don't know it is spread in the bone or somewhere else. Okay, but PET CT scan give you the whole details, so it helps the doctor that okay, my patient doesn't have only in the breast, there's something else like bones, lung or somewhere else she is affected. So doctor can alter their treatment policy and start the full cancer care treatment. And this is how even we can increase the survival rate of the cancer. Okay, and patient can cure completely. Otherwise what will happen, patient can be treated in the best parts, but they don't know other spreads, metastasis they don't know, so that cannot be treated. It's possibilities. And even after the treatment, after PET CT, I mean chemotherapy, radiotherapy and other targeted therapies, so patient don't know what is the status of the body. So post treatment follow up they can do by PET CT scan, and it will give you after post treatment follow up whole body status. This is how it can help. And even after surgery we can do PET CT scan, so we can understand that whatever the small lesion remain in the operated areas or not. If it is remain, then doctor can plan accordingly after the PET CT scan. Okay, there is some lesion remain, then doctor will treat their chemotherapy, they will take their own decision. And even there is nothing remain, then doctor can be okay, she is fine, she is cured. So this is how we can say this PET CT is called third eye of the doctors.
So, what's your advice to people out there and to the Nigerian government?
I personally advise, as a long time experience on this field, over 12 years. So I advise PET-CT should do by all the cancer patients, because otherwise you will be blind. Very simple. You'll be blind and you cannot get the complete treatment decision you cannot take. That's why we call this one PET-CT based treatment plan.
Joining me now is Dr. Adeoluwa, is the head of strategy, Mecure Healthcare Limited. Thank you for joining me, sir.
You're welcome.
Thank you. So let's talk about Mecure Cancer Center. Why was it established?
Okay, thank you very much. Mecure Healthcare Limited, it's now a household name in Nigeria.
Okay.
We started about 14 years ago when we saw that in the healthcare space, that there's no diagnostic center where you can do all your tests in one place. To do any test, you have to go from one center to the other. So Mecure was better, and then we started providing all the diagnostic services under one roof. Now, we are a very innovative company. We're always thinking how do we make things better. And about 10 years ago, the chairman talked about it, that there's no cancer center in the whole of Nigeria, in the whole of West Africa, where a PET-CT can be done. It means that if somebody has cancer, at best, we can only do a CT scan. We can't totally get that this is the stage or this is the extent of the cancer. And so he bettered that idea, and then with the directors and with support of the entire Mecure staff, he was able to keep the ball rolling. And 10 years after, we were able to set the first cancer center with a PET-CT and a cyclotron manufacturing unit. So it means that everybody in West Africa, they are coming here for their cancer treatment to get a PET-CT done. And it's not just PET-CT that we're looking at. It is a 5-story bunker, 3-story up, 2-story down, and it's a full cancer center. We're installing the radiotherapy, chemotherapy, started, brachytherapy, all form of cancer treatment will be done here, even surgical therapy as well.
Great. So what's your mission?
Our mission is to give access to every Nigerian that is unfortunate and is being diagnosed with cancer. We believe that cancer is no longer a death sentence, and the cost of care is no longer a barrier. Okay. So we've set up the center to provide care to people that have been diagnosed with cancer. We've set up the center to prevent people from coming down with cancer itself. We've also set up this the center to ensure that people are able to afford it. Okay. And so there are a lot of things going on in terms of affordability and universal health coverage. So we are actually championing the concept of universal health coverage, access to healthcare, the health service that you need.
Oh, great.
This time around in terms of cancer.
All right. So are there activities you have put in place to achieve this?
There's so much. The first one we've done, or one of the ones we've started is, we call it the 2080 Beat My Cancer project. Okay. We're looking at the concept of why are people not going to the hospital? Mm-hmm. Why are people not utilizing the health service that they need? Mm-hmm. Why is the access to health poor? Why is the hospital utilization poor? We believe that a cancer center has been set up. You will expect that, every cancer patient will be rushing in. But there's a barrier, the cost of care, and the people that have cancer, and the center. Yeah. So we're bridging that gap, creating what we call angel sponsors. Okay. Now, the Good Samaritan, the angels, which say that, look, if you support somebody that has cancer with as little as 15,000 naira every month, that same amount of money you're giving for the support of the cancer patient is still your own. You can still use it to do your own diagnostic test, prevention test at Mecure. Wow. So you're giving to support the cancer patient. At the same time, you're also taking care of your own body. So to celebrate this year's World Cancer Day event, we are one of the few. I've not seen any other center. We are screening 1,000 people for cancer. Like we said, we want to prevent cancer. Any detection, they said, saves lives. So we have over 1,000 people that have registered so far. And this screening is going to go from February to March ending. So we see how more people registering. The link is on online. You can click it and then you can get yourself registered. We are pushing especially for people that at one point or the other they have a family that has had cancer before, because statistics have shown that once there's a person in the family that has had cancer, the chances of other members of the family coming down with cancer is also higher. So why not let's detect them early? Let's ensure that they get screened instead of waiting for them to come down with cancer before they come. So let's catch them early. So we are screening the population to say that look, prevention is usually better than cure.
In 2023, the global community commemorates World Cancer Day with the slogan "Close the Care Gap," which is about understanding the inequalities in cancer care.